Let me take you on back here to the manual therapy area. So this is where we do any sort of myofascial and musculoskeletal work with our patients, be it chiropractic care, myofascial release. We have tools for muscle scraping. We have different tools to work on arms and legs and ribs. We have vibratory therapy here. We even have spring-loaded instruments for adjusting some of our more sensitive patients. Come on to our examination area. So this is where we figure out what we want to do with our patients. In order for us to diagnose our patients, unfortunately we can't really rely on a scan or a lab for a lot of the conditions that we see here, especially our concussion, dizzy, and migraine cases. For those conditions, we really can't look to a lab and a scan because it doesn't really tell us all that we need to know. So instead, we need to rely on an in-depth physical to pull apart the patient's brain function by function to see what's working okay, what's not working as well, and then from there, we look to see of all the things that aren't working great, is there one or two areas of the brain that we want to work on? From there, we design exercises to safely stimulate that part of the brain to build as much plasticity in it as possible. Now, in order to figure all that out, though, we have to rely on a relatively comprehensive examination. So our exam at Nexus takes about 90 minutes to get through. It starts with a basic physical examination that you would get at pretty much any other doctor's office, but then we dig a little bit deeper into your function. We look at coordination, we look at balance, we look at cognitive function, we look at inner ear function, we even look at eye movements. So right down here, we have a device called CAPS. This is the gold standard device for measuring posture and balance. Over here, we have a device called a VOG, or a video oculographer. This is a set of goggles with two infrared cameras mounted to them that allows us to record and graph your eye movements. Coming over here. So this device allows us to get a live readout of how our eyes are moving. So we see a live recording of how the eyes are moving, but then we get a lot of data along with it. So we can see the smoothness of the movement here. We can see the gain, or how much behind the eyes are from the target here. We can see the symmetry of each eye to make sure that they're moving in tandem, and then we can even see the size of the pupils as they change. All right, come on back to the last area. This piece of equipment is our QEEG, stands for Quantitative Electroencephalogram. And we don't use this for everybody, but we primarily do this assessment for our ADHD patients, for our stroke patients, and for our concussion patients to help us assess and evaluate their brain waves. This is just touching the surface of all the fun equipment that we have here. If you're interested in learning more about all the technologies that we're using at Nexus Brain Center, be sure to follow along so you can keep up.